everyone, my name is Anal Salvia and I am a third year life science student from St. Xavier's College. In this video, I'll be talking about the clinical significance of our visual system. We all are aware about three basic defects of our eye, that is myopia, hyperopia and astigmatism. So myopia or nearsightedness is a condition wherein people can usually see things that are at a near distance but cannot see things that are far away. This usually happens when the eyeball is too long or in rare cases the cornea is too curved. The light that enters the eye would not be focused on the retina and would instead focus in front of it. Whereas in hyperopia, the opposite of myopia occurs. People can see objects far away from them clearly, but nearby objects appear blurry. Here the light gets focused behind the retina due to shortening of the eyeball. Myopia and hyperopia can be corrected by using glasses or lens of the correct power. Talking about astigmatism, it is the imperfection in curvature of the eye's cornea or lens. Here both near and far vision appears to be distorted and can be corrected by wearing cylindrical glasses. Now, I'll be talking about some disorders of our visual system. The first disorder that I'm going to be talking about is a cataract. A cataract is a dense cloudy area that forms in the lens of an eye. A cataract usually develops when the protein in eye forms clumps that prevents the lens from sending clear images to the retina. The proteins that are known to form clumps are alpha A and B crystalline. The vision of people with cataract is like looking through a frosty or a fogged up window. The second disorder is age-related macular degeneration or ARMD. As the name suggests, age-related macular degeneration is seen in people usually above the age of 45 to 50 years. In this condition, there is a loss of vision in the central field, particularly because a region of retina called as macula is damaged. ARMD is basically of two types, that is dry and wet. Dry ARMD is very common and happens when parts of the macula get thinner with age and tiny clumps of protein start growing. Whereas wet ARMD is when new abnormal blood vessels grow under the retina, causing a scar to develop on the retina. The next disorder that I am going to be talking about is glaucoma. So our eyes produce a clear fluid called as aqueous humor that fills the space between the cornea and the iris. This fluid filters out through a complex drainage system. It is the balance between the production and drainage of this fluid that determines the eye's intraocular pressure or IOP. Glaucoma is usually caused by increased IOP, usually resulting from a malfunction in the eye's drainage system. Increased IOP can cause irreversible damage to the optic nerve and retinal fibers, and if left untreated can also result in permanent loss of vision. Cataract, ARMD and glaucoma can be treated with laser therapy and surgery. The next disorder in line is diabetic retinopathy. This is the most common diabetic eye disease. It has 4 stages of development. The first stage is called as a mild and non-proliferative retinopathy, where small balloon-like swelling occurs in the retina's tiny blood vessels. In the moderate proliferative stage, the blood vessels that nourish retina start getting blocked. In the third or severe stage, the blocked area starts sending signals for the formation of new blood vessels, which start developing by the fourth stage. But the new blood vessels are abnormal and fragile. If they leak blood, severe vision loss and even blindness can occur. The best way that is known to treat diabetic retinopathy is photocoagulation, which is a focal laser treatment to stop or slow down the leakage of fluids in the eye. And the last disorder is Umbylopia. Umbylopia is a disease of the eye that occurs early in childhood, anywhere from birth to 7 years of age. Because the nerve pathway between the brain and one eye are not properly stimulated, this results in brain favoring the other eye. It is very difficult for children with Umbylopia to read and understand, as it is often linked with learning disability. Umbylopia can be recognized in children when both of their eyeballs do not work or move together. Eye patches and Bangerter filters are often used for the treatment as they block light transmission and reduce visual activity. Bangerter filters are applied on the backside of spectacles for about 2 to 6 hours depending upon the stage of the disease. Now, I'll be talking about some visual pathway lesions. So, the visual pathway consists of structures that carry visual information from the retina to the brain. Lesions in that pathway can cause a variety of visual field defects. In this video, we will be covering two such visual field defects, that is optic neuritis and heminopia. Optic neuritis is basically a lesion in the optic nerve. Optic neuritis typically begins with eye pain, especially with eye movements. Within a few days, patients will notice blurred vision in the affected eye. Often this appears like a thumbprint or a smudge that is blurring the vision. Within a week, this may progress to darkening of the part of the visual field. Some people with optic neuritis even report seeing flashing or flickering lights with eye movements. For diagnosis of optic neuritis, pupillary light reaction test is done. The doctor moves a flashlight in front of the eyes to see how the pupils will respond when they are exposed to the bright light. In patients with optic neuritis, pupils do not constrict as much as pupils in healthy eyes would when exposed to the light. Optic neuritis often improves on its own within 6 months, or even steroid medications could be used to reduce the inflammation. And talking about heminopia, it is the partial blindness or loss of sight in half of the visual field. It is of two types, homonymous and heteronymous, as can be seen in the picture. It results in the person having double vision. At earlier stages of the disease, the patient is recommended to wear prismatic or prism correction glasses, as the prism will help to align two images so that a single image is seen. But in later stages, if situation becomes worse, vision restoration therapy is done. Thank you.